you hear this? Yes. I told you that you can't hear. Don't let me just stay here and talk. Okay? So this is something that you put in the throat to help the person to breathe. Alright? Sometimes you get this because of an accident. Alright? Your whole face is already injured. Filtering, huh? Yeah. Okay, you know with COVID everybody is paranoid. Betul tak? You also paranoid, right? You're so worried that I'm getting COVID. I'm also worried that you're getting COVID. Alright? But I know you all been tested, so it's okay, alright? So this is called a tracheostomy. Alright? Tracheostomy. So today I'm going to talk to you about tracheostomy and how you're going to care for. Okay, maybe you have a resident or you have your patient who's got a tracheostomy. How you are going to look after that person, right? So at the end of my talk, you'll be able to, alright, tell me what. Okay. So at the end of this topic, you'll be able to define what is tracheostomy. Tell me what is tracheostomy. If you don't want to write, it's okay because I'll give one set of notes. If you want to photocopy whatever you want to do, you can do it. Right? Maybe some of you would like to write because it might give you a break. So either way. So you know how to care for a patient with tracheostomy, alright? Prepare the equipment that you need to do the suction of the tracheostomy. And also you must know what are the type of secretion that the patient is doing out. Secretion means what is coming out, alright? Like we all when we cough, alright, sometimes our sputum is yellow color, greenish color, you know, whether it's thick, whether it's watery, alright? And then whether got any smell or not. Sometimes when we have an infection of our lung, the sputum becomes very smelly, right? So then you have to go and see a doctor to get some antibiotics and all that. So this is very important because you must know how to look at the situation. If you think something is bad, then you know you have to call the doctor in or bring the patient to the hospital. Okay? So tracheostomy is a medical procedure, alright? Where it's either temporary or permanent. Some people after the injury they are better already. Then they will take out the tracheostomy, they breathe normally, alright? But some people are very unfortunate, they have to live with it for the whole life, alright? So it can be temporary or it can be permanent. So what do we do? The doctor do actually make a hole, alright? Hole in the neck is how you place a tube into the patient's windpipe ataupun trachea. Your trachea is, you know, when sometimes you eat, suddenly cough, cough. Because why? The food instead of going into your throat, going to the stomach, accidentally it's going to the trachea. So that is why you get that sound, you cough accidentally, alright? So that is where they're going to put the opening, alright? So it is a medical procedure which is done in a hospital. But some people are smart enough, sometimes when you go camping and everything, some people know how to, because you're having some difficulty in breathing, they know how to do the incision for you, alright? So the tube is inserted through a cut in the neck, alright, below the vocal cord. Don't go and cut the vocal cord, nanti you can't even talk, alright, no sound, alright. So this allows air to enter into the lungs, alright. Breathing is then done through this tube, alright. It is not through the nose or through the mouth or the throat. So that patient will be breathing through here. All his air is coming out to here. So this one is a direct connection into the lung. Like you and me, we are breathing, go through our nose, and then go into our throat, then go into our lung. Alright? This one is direct connection. Alright? So look at this picture. Alright? You can see how the tube is placed and how the patient will look when he's having a tracheostomy. So that is what you'll have all the time. Alright? So this is how the patient is going to look like. So the incision they do is very small, minimal, and then they just make a small cut, and then they open up. Then you make a small hole there and then they just push the tube inside. And then the tube is left inside. Alright? So that is how the patient is going to cough and that is how the patient is going to breathe. Alright? So there are a few types of tracheostomy tube, but most of it all got a balloon outside. So that balloon actually is very important because you don't want the patient to cough suddenly and then the tracheostomy tube fly out. Alright? That is the worry for us when the tracheostomy tube come out. So you always have to check and see the balloon is nice and hard, not soft, flat already. All you have to do is just take a syringe and push a little bit of air, about 1 to 2 ml of air, the thing will become tight again. So the tube won't get dislodged. Alright? So these are the parts, alright. You can see the cannula, you can see the balloon, you can see the cup, alright. You got the flange, which is the one that is outside here, like a small bow tie, where you tie the tracheostomy tube around the neck. Because if you don't tie the tube, the patient coughs suddenly, the tube can come out. Alright, so very important is the tying of the tracheostomy tube and the dressing them. Okay? Okay. So in the care of the tracheostomy tube, what is very important is suctioning. So this is what I'm going to talk today and show you the practical session of suctioning. Alright? We must make sure that we suck the tracheostomy tube frequently. Why? Because we want to keep the airway free of mucus. Mucus means like saliva, slime. Alright? So we don't want the thing to get blocked. If it gets blocked, what will happen? Cannot breathe. It cannot breathe, what happens? Become blue, sweating, everything. Then you try and suck and see all hard inside. It's very difficult to come out. Then most probably you have to rush the patient to the hospital. Okay? So that is very important. So we want to help to keep the airway free from secretion and also to make the patient to breathe better and reduce the risk of lung infection. In a long time, you leave the phlegm there, you don't bring it out. Even you yourself, if you got a cough, it's better to bring the phlegm out. Sometimes you find it irritating, but if you just leave it there for a long period of time, you also can get a lung infection. Alright? So lack of proper suctioning is a major cause of infection in people who have got the tracheostomy tube. Alright? So you must know how often your patient needs to need the suction. Sometimes at early part, you need to do maybe every 2 hours and all that. So you can, when you are looking after the client, you will know when and when to do the suctioning. Alright? Suddenly you hear sound. That is all bubbling there. So much of secretion there. Some patients, they can cough it out. Alright? If they cough out, your job is easier because you just suck on the top only, take out all the secretion. But some cannot do that. Alright, you have to put the tube right inside, then suck the phlegm out. Okay? So far so good? Yes. Okay? Alright. So now, we are going to talk about suctioning. But before we do the suctioning, we also must assess the following from your patient. You cannot simply go and suck the patient. Alright? First, you look at the respiratory status. Respiratory status means how is he breathing. Alright? How is he breathing? Is it like that or normal breathing? Alright? Is breathing in properly? All that. You have to look at it first. And then, now you know we got the pulse oximeter. And check the oxygen saturation. Yeah. You must know the saturation level. Alright? So that's very important. Pulse rate. Sorry, I don't talk for a long time. Right. Pulse rate. Pulse rate is count the pulse, right? But if you got a pulse oximeter, the saturation and the pulse will come on there, right? You don't have to breathe. And then look at the secretion from the tracheostomy, alright? See whether how much of secretion and then the amount, the characteristic. Characteristic means how does it look like? Is it greenish color? Is it yellowish color? Is it thick color? Is it a watery kind of secretion? And then presence of drainage on the tracheostomy dressing. So just now the patient had a tracheostomy, he got a gauze there, right? So you look at the gauze, whether the gauze is soaked or anything, alright? And then look at the appearance of the incision. See the cut there, whether got any redness, or swelling, any discharge or odor, smelly or not. Because sometimes your tracheostomy site can be infected, right? So all this you must observe first before you start your suctioning. So you go, okay, just say, Mr. X, I'm going to do suction for you today for your tracheostomy. You just hold on and prepare my, all my things first. But before you go, I said, just want to have a look at your dressing, how is it, everything. Just have a quick look, alright? You don't have to keep a detailed account, but just have a quick look. You need what you think you need to bring. Later, you do that, alright? So now I'm just going to walk you through the procedure. Just listen to me, but when we do the practical, it's much easier when you will understand it. But you need to know the steps, alright? I can't simply go to the procedure without you knowing the steps, alright? So first thing is patient preparation. What you do is, anything before you do any procedure is wash your hands, alright? Wash your hands, clean it with a clean towel, and then you go and position your patient, alright? Your patient is lying back or what, you must bring the patient up. put him about 30 to 40 degrees. Alright? If you don't have like a hospital bed, you look at why not, right? Yeah. But at home, where got that kind of bed? Alright? So what you do is you take the pillow. Put the pillow at the back of the patient's neck and the back. Alright? So you can get that angle. Alright? If the patient has a cuff tracheostomy tube, I told you about that, you know, the balloon outside, you must make sure that the cuff is inflated properly before you start. Alright? If you see it's already flattened, you go and take a syringe, you go and inject and make it a bit hard. Alright? Because if you are not, you don't get it inflated, the tube can come out when you suction. Because when you're sucking, you know what happens? The patient will start to cough. When they cough, what happens? Will come out. Alright? So you make sure that it is inflated. Right? If it's not inflated, there's no cup anything outside, make sure all this is tied properly at the side. Alright? That's very important. So you can see the patient is propped up, alright? And then checking the tube, whether the balloon is inflated or not. Alright? So the procedure, we already told the patient, alright, Mr. X, I'm going to do some tracheal suctioning for you. We already bring him up, prop him up nicely already. So now you must make sure you got a suction machine. This is a suction machine. Alright? This is a suction catheter. The catheter for adults is about 40 to 16, the size. Alright? You just see the size of your patient. Alright? And then we have this tubing. Alright? Most of the time, this tubing, if you are the first one doing it, this is all wrapped up inside the plastic. Alright? That's why I don't have the plastic here, but right when you fix this already, the plastic must be put here. Because you want to keep this place as clean as possible. You cannot be putting here, putting there, everywhere. What happened? Infection. Alright? So this one comes like this. This one is like a single use only. But this tubing, when we open in the morning, we can keep it for the whole day. We don't have to change every time. But this one, we try to change every time. But if that's the patient that you're looking after in a home or in a house, it's okay. You can keep it for 2-3 times and then you can discard it. So that's why when you open all this, you must be careful because you want the plastic wrapper back. Because you're going to put it back inside the wrapper and keep it clean. Alright? So this is the thing. And of course, you must have normal saline. Alright? This is a solution that you're going to use to flush the tubings and all that. Because when you suck already, you must clean the tubing. You know what will happen? All the flag all stuck inside there. Can you imagine? It will be very dirty. Okay? So these are the things that you require. Okay, I got some pictures. Actually, the last time when I came here, there was no suction machine. Alright, so I was thinking, telling you all you might not have an idea. Alright, so now you have, you know how to do. This is a portable one, and this is the one that usually is used in the houses. Alright, hospital all got on the wall. It's already fixed on the wall, so you take from there and then you do the suction. Alright? Okay, the method is, first is, again, go and wash your hands. Because you touch all these and you are. Alright? So it's a bit dirty. So wash your hands with soap and water, dry with a clean towel, and then you go and attach this suction tubing to the machine. Alright? And this open end must keep into the package. Alright? There's a plastic, I told you, right? So this open end you keep in the plastic. Don't let it be exposed like this. Alright? And then you open a dressing set or a tracheostomy set, whatever set they give you. Maybe just 2 small containers only, because you just want to use for saline only. Alright, so you must have that 2 containers. Because sometimes we don't have all that set, we just like to open a dressing set. So easier, you can pour the saline into the dressing set and we can use them. We can suck from there. Alright? And then we add the suction catheter into the set. Okay, just say this is my dressing set. I open up already. Okay, I will open this and I put it into the dressing set. Alright? That's what I mean. Attach put this inside. Because after this is going to be like a sterile procedure. You cannot go and touch here, touch there, contaminate everywhere, and then go and suck the patient. That means you're bringing infection from outside into your patient. And that will make more problem for you. Because the patient gets infection, who got more work? You got more work. You have to suck frequently, you have to give maybe oxygen, you have to give a nebulizer, all that will become your problem. Right? So that's why we want to make our job easy, we do according to the process. So we don't have any contamination. Okay? So now I've already added this into my dressing set. Alright. Then I'm going to pour the normal saline into the galley pot. Alright. So all this is ready already. Now I'll bathe again and wash my hands. This time I won't wipe my hands with a dirty towel, not towel, a clean towel outside. I'll come back, in a dressing set there's a paper towel inside. So you take that paper towel and wipe your hand. So now your hand is considered clean. Alright? So you wear sterile glove or you not clean glove. Either or. Alright? You have to wear that glove. Alright? So now I have already put here everything already. I wore my glove already, everything. Of course the mask is on, don't forget about the mask. Alright? So you have my dominant hand is my right hand because I do every work with my right hand. Alright? So I call this is my dominant hand. And this is my non-dominant hand because I'm not a left-hander. So you have to make sure one hand is always kept clean and one can touch here, can touch there, can touch this. Alright, because this is outside. Okay, so you can use that. So that's what I meant. But if you are a left-hander, then you have to use your left hand. Alright, don't try and use your right hand to do things when you are not able to do. Then you will contaminate everything. So you must know yourself, whether you're right-hander or left-hander. So that's what I mean by non-dominant hand. Alright, so take the suction tubing. Alright, then I will connect it to the suction catheter. Alright, then I will switch on the machine. Alright, you can hear already. And then check the suction pressure. Okay, here they don't have numbers, but if you have numbers, you just put it about 80 to 120. Alright, just push the knob up to 80 or 120. Alright, then you will lubricate this before you bring it up to the patient. Lubricate means you put into the normal saline to make it a bit wet at the end here. Why I want it to be wet is because this is quite rough. Alright, so when it goes in, it will irritate the patient's throat. Alright, so you want to lubricate so that it can also must go in easily into the tracheostomy tube. Okay, so that is why you lubricate. So once you already lubricate, either you can wrap the catheter around your glove hand to avoid, because sometimes this is very long. Sometimes when you touch here, touch there, then go inside here. Contaminated. Alright, you can wrap it up in your hand. Okay? So with your finger, this is called the suction vent. If you close this, you get a vacuum. You can suck out. Alright? If you lift your hand off, there is no vacuum. So it's very, 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 very important that when you are going inside, your hand must be off this. Alright? Because if not, you're going to suck all the patient's oxygen out. So you leave your hand off, go right inside, already reach about maybe 3 to 6 inches, or you can find a resistance there to cope when you don't go and push some more. That's enough already. Then only you close, you rotate slowly, the patient will cough, all the phlegm will come out and take it out. When coming out, only you close. Going in, cannot close. Alright? Until you reach the point where you cannot go in anymore, then you close it, suck slowly, rotate, come out. Alright? So that's how you do it. Okay? Once in, cover the suction vent with your thumb of your hand to apply suction. For me, it doesn't matter. You want to use your thumb or you want to use any finger you want, also it's okay. Up to you, how comfortable you are. Alright? Then we draw the catheter and rotate using a slow and even motion. Then roll the catheter between the thumb and forefinger. And then once it comes out ready from the patient, again go into the normal saline, close this and clean your suction tubing. How long you can be inside here is only 10 seconds. Don't think the patient coffee, never mind. Go in, come out, go in, come out, go in, come out. Because when you're sucking all the patient's oxygen, then after you check your pulse oximeter, wow, from 99 coming to 95 and then 90. And then the patient suddenly turning blue. Why? Too much oxygen already sucked out. Alright? So just go in, rotate everything, by 10 seconds, come out already. Alright? And then you just wait for another 2 to 3 minutes, then you go in again. Do again the same thing. Alright? And come out. You can do up to a maximum of 3 to 4 times. Alright? If still a lot of situation, don't continue like until 10 minutes also not finish, 15 minutes also not finish. No, it's too then you can go and redo the suction. About an hour later, 2 hours later. That means you have to do more frequent suction. Alright? By one go, don't take more than 3 times or 4 times. Alright? Flush catheter with normal saline. Repeat suction if necessary at a maximum of 3 times or 4 times, it doesn't matter. Then give an interval of 2 to 3 minutes before each suction. It doesn't matter the minutes, you don't have to count 1, 2, 3, 4, or look at the watch everything only. By the time you bring out, you go and clean your catheter again, and by the time you go in, it's about 2 minutes already. Alright? So you do the second suctioning. Then the same thing, go in, don't close the vent, take out, suck slowly, within 10 seconds, bring out, again clean your suction catheter, and then go back again for the third time. If suddenly you suck 2 times, it's clear, nothing already. You don't have to go for third time, 4th time again. Alright? We are talking about third, 4th time is when there is a lot of secretion. Suddenly yellowish, greenish color all coming out. Sometimes patients cough 2, 3 times, you suck already. 1 time, you suck 2 times, clear already. Then leave it. You don't have to continue suctioning. Alright, just because I say it to the maximum of 3 times or 4 times, you want to do 3 or 4 times. You have to look at the secretion. Alright? So you flush the catheter with and toning with the normal saline to clear all the secretion. So when you finish this one you suck a lot. Because why? You have to clear all this tubing. You want this tubing to be clear again. You don't want all the secretion to be here, stuck in between anywhere. You don't want that. Alright? Then you can switch off your suction machine. Alright? Disconnect the catheter. Alright? And discard the catheter and the receiver. Alright? Then you can roll this up in your glove. Open it up your glove and throw it. Alright? This one, you have the package, right? And you put it into the package. And leave it here. So the next time you want to suck, you only have to open this new one. Alright? And fix it. Alright? So at the end of the day, what happens to all the water here and all that? You must take out and you wash it. Just use with plain water and soap is good enough. Alright? And if you are using it in the house, it's a better idea if you have a little bit of water inside before you start. Why? If not, all the secretion will get stuck everywhere. Then it will be a problem for you to clean it. Alright? So at least you put some water inside. Alright? Or if you want to put normal saline, I don't expect you to take tap water and put inside. We are talking about boiled water or something that's water that is clean. Alright? You put inside there. So you finish that already. That is your suction finish already. After that, you must prepare to change the dressing. Alright? Is anybody teaching you the dressing or do I have to teach? Daddy, do I have to teach the tracheostomy dressing? Together? Okay. Okay, so come to dressing again. If your set is still clean, alright, it's okay. You can still use the same set. All you have to do is go and wash your hands again. Come back, wear a pair of surround glove again, and then put the saline there, and then start cleaning your tracheostomy. Alright? You clean the tracheostomy from inside out, alright? Then you clean round, and then after that you clean the phalanx, alright, or the plate here, you clean that out, alright? Then you dry, pat dry, then you put a dressing, alright? Show you after how we do the dressing, alright? You can use a commercially prepared dressing, the tracheostomy dressing that comes in a pack already, where they already cut already, so it's easy for you to put the dressing inside. Alright? Another thing is you can open your own gauze because maybe your boss never buy that dressing, but you can use the gauze in the dressing set. So that one, nobody now encourages you to cut that dressing to make that shape. Because why? When you cut, the gauze got fine, like a thread, right? So that one we don't want, because the one will get stuck inside, suddenly go inside the tracheostomy tube. So what you do is just bend the gauze like a V shape and push it in. Alright, after that I show you how you do it. Avoid using cotton filled gauze squares or cutting the gauze. Alright, never cut the gauze and put it here. Those days I know we also used to do. Like my time when I was working, that's how we used to do our dressing. Alright, cutting the gauze, everything, and then sometimes we soak it in iodine. Then we'll squeeze it, then we'll apply. If the wound is quite dirty and everything. But if the wound is clean, just use a normal, plain gauze, is good enough already. Alright? But after a few years of studying everything, they found that a lot of infection and all, it's just because of the gauze that we cut. That's why now the company very smart, go and get this gauze and for you prepared, ready, packed already, so you can buy and use it. Okay? Place the dressing under the flange of the tracheostomy tube. While applying the dressing, make sure the tracheostomy tube is firmly supported. Alright? Don't simply push, and then suddenly your tracheostomy tube come out. So you must support it and push the dressing inside. Okay? So this is an example of the commercially prepared dressing, like the one you see all prepared and cut ready. Alright? So this one, if you buy, then you don't have to worry about how to fold the gauze and put it under the tracheostomy. If this is available, then you just, after you're cleaning everything, just put this dressing there, and that's it, finish. Alright? But if you have to use the one that is inside the dressing set, that gauze, then you must learn how to fold the gauze. Alright? It's not very easy, not very, difficult, just fold it into a V shape only. Bend the gauze this side, so it becomes a V shape. Alright? And then make sure you also change the head. Alright? Because sometimes the patient, all the secretion come out, soak the gauze, and then the head also become very dirty. Alright? So you have to change the tape. Alright? You change the tape and you tie a knot. This tape is actually, if you see the white color tape, that's the tape they use. Alright? If you have a tracheostomy set, that tape will be inside there. So you can use it. If you don't have, then you have to cut the normal white color tape and then use it to tie up. Alright? Check the tightness of the ties, because regularly check the tightness, because you might want to make sure that the tube is always in position. Alright? Because you can get looser and everything. So every time when you are with the patient, because we don't do the dressing every time we don't do suction. We only do it once. Unless it's dirty, then we change again. Alright? If not, it's a daily change of the dressing and the tie. Alright? We don't unnecessarily open, retie back again, open, retie back again. Unless you see here all got the phlegm all stuck, and then sometimes when you start got a little bit of blood, the blood so thin all around there, then you go and change it. Because you don't want a dirty dressing there. What happens with a dirty dressing? You get infection. Alright? So that's the reason you change. After when I'm doing it, I'll show you how I do it. Right? So very important is when you are doing the suctioning, you must always observe the patient. Alright? Or observe your client. Don't be busy looking here and there. Alright? Because you must look at the color. Color means what here? What does the color here mean? How do you know if you are having difficulty in breathing? What happens to your face or? Huh? Yeah, you become pale, become bluish. Now you can see the lips all become blue. That means why not enough oxygen. That's why only blue. Alright? So you have to look at the color. Alright? The patient must be pink, not sweating, not anything else. Alright? And there must be no bluishness around the lips. Alright? And look at the respiration, whether it's breathing too fast or he's having such a difficulty in breathing. So you also must observe this. Alright? If you find that your patient suddenly turn blue, don't do anything, stop the suctioning, give the oxygen, and you wait. Alright? You wait for a while, let your patient rest, everything already, recheck his pulse, if you got a saturation, it's better. But if you don't have, you just look at the color of the patient. Or not dripping, not bluish, alright? And not sweating. And then the breathing is regular. Going in, coming out, going out, like how you breathe. Alright? So then you can redo the suctioning if you think the patient is still chesty. Alright? So that is very important when you're doing your suctioning. And also you must observe the mucus. Alright? So you must know how much came out. How do you know? Are we going to measure? ml, how many ml cannot lah. We only know is by the how many times we suck. If I just suck the patient 2 times, I can say it's a small amount. If I suck the patient 3 or 4 times, I can say it's a large amount. That's how we approximately. Alright? That's how you will know how much was sufficient. Alright? Small amount or large amount. Alright? Consistency is how does the secretion look like? Is it thick or is it a watery kind of secretion? Alright? That's what I'm saying. And then the color. What color is it? Yellowish color ke, greenish color ke, whitish color. Alright? And then got any smell or odor? Alright? Is it smelly? So if you have finished your suctioning, all you say is Mr. X small amount of whitish secretion, alright, with no odor. That means okay lah. That means it's not having any infection or anything. That's how you're going to report back to anybody who asks you. You just did Mr. X suctioning. What was the finding? They say, oh, he only had a small amount, whitish in color. It was a thin kind of secretion, and there was no smell. Any story, alright? But unfortunately, something happened. Mr. X had large amount of secretion, but it was greenish in color. It was greenish and it was thick, and there was a foul smell. So that means they know what to do. Alright? The person who is in charge will know what to do with the person. Alright, suctioning is done depending on the amount of secretion. Small amount, do you need to go and suck every hour? No need. 2 hours? No need. Maybe 3 hours later. Alright? But if it is thick and they're smelly and it's a lot, then you might have to do 2 to 4 hours. Alright? So that is very important. And you change the dressing if it is soiled or if it's dirty. Other than that, don't go and simply touch the dressing. We don't want to go and, every now and then go and change dressing and all for no apparent reason. Sometimes you think you're doing good, but you can also bring infection to the patient. You keep on touching here, touching there, doing here, doing there. If you think something is dirty, then only go and touch it. You not just leave it. Alright? So these are the signs that need medical help. Alright, if you're doing a tracheostomy dressing or suctioning, if you notice that it's pain at the tracheostomy side, your patient is saying, very painful, and then your resident already got fever, alright, and then the skin around them become gray and inflamed, and then there's pus or foul smelling, drainage coming from the stoma or the tracheostomy, you have to make sure that you get help for this patient. Either you call in your resident doctor or you might have to send the patient to the hospital. Alright? But if you have difficulty of breathing, suddenly increased heart rate, or if the tube come out, don't wait for anything. Call 999 or if not, send the patient to the hospital urgently. Because for you to push back the tracheostomy tube inside is not easy. You need a kind of introducer. That you must know when to push in. When the patient is taking a breath, the time of pushing or what. Because if you don't know and you go and push in, you can traumatize and the patient start bleeding. Here all start bleeding and then the whole lung will be flooded with blood. And then it will be more problem. The easiest thing you can do is quickly bring him to the hospital. Alright? So look at these pictures. Does the tracheostomy side look good? No, isn't it? It looks pain or pus and all that. So that's why, if you notice all this, it's very, very important that you should know the difference between a clean wound and a dirty wound by now. Alright? You yourself will know. When sometimes you have a cut, it heals okay, never mind. But suddenly you see redness coming there, and then when you touch, it's very painful, and then suddenly you see something like yellowish coming up, you know it's already infected. The wound is infected. So it's still okay. But once you get fever, that means it's gone into your system. You need antibiotics. But if it's just here with no fever, then you just need to clean this wound, put some antiseptic solution there, and you get better. Alright? But the day you see this wound gets worse and you end up having fever, you know that even if you clean out well also, you still need a course of antibiotics. Because the infection is already into your system. Alright? When the infection goes into your system, that's when you get fever. Alright? Other than that, you won't get fever unnecessarily. Alright? So, it's important, alright, in summary, it's very important to carry out the suctioning of tracheostomy regularly using aseptic method. Alright? This is to prevent infection to the lung as the tube is connected directly into the lungs. Alright? So that is why you must make sure that whenever you're doing this kind of suctioning, you must keep it as clean as possible. Alright? In the hospital, it's considered aseptic technique. But in the homes, it is supposed to be a clean technique. Alright? Clean technique where we try not to cause any infection for the resident. Alright? And it's also important to change the dressing if it is dirty. Alright? So any questions for me? No? So 10 or 15? Then you can watch me do it first. Alright? Then later, if you have the time for second round for demonstration, or somebody can give a written demonstration. But looking at, I only got 25 minutes left.